COVID-19 isn't over when it's over.
I used to be like a busy person, but now it's like I'm not even know if I'm gonna be okay the next day.
Thousands of people who survived the virus just can't seem to shake the symptoms, even months after their diagnoses.
Heavy pressure in my chest.
Loss of balance.
Bruising on my arms.
Heart palpitation.
Headache, fatigue.
Jaw pain.
Back congestion.
Abdominal pain.
No appetite.
Burning sensation.
Hives and rashes.
Fevers, which I've had for over 160 days.
We spoke with more than 80 people who have lingering symptoms. They call themselves long haulers, and it's a population that's only growing.
Some people are lucky, they only take a few weeks to recover after they've been sick, but then there are the rest of us that it will take us a long time.
It's like a dream that is getting longer for me to wake up. There is some days when I'm happy, and there is some other days when I don't have feelings. Some days I feel my mind sharp. Other days I don't even know where I'm going or what I'm going to do in life.
Before COVID, Hector Martinez didn't have any mental health issues. Now he has anxiety and depression. 4 months after his first symptom, he still feels sick. He's always tired. He has brain fog.
Every time that I go to sleep, I'm always praying to God to be better the next day.
Hector is an electrician, but when he went back to work in July, he couldn't remember how to install a light switch.
I felt like if it was the first time doing it. That day I even cried on my way back to home. I was asking to myself, like, how can this be happening to me? Like, I got my license. I went from getting my apprentice license to my wireman to my journeyman. So how can this be happening to me?
Now he can only manage to work a few days at a time.
I feel insecure about my future. I feel unsafe about my life.
Lingering symptoms don't get nearly as much attention as the race to find a vaccine. But some doctors, like neurologist Svetlana Bleachstein, have been treating patients like Hector.
What I see in my clinic are patients presenting with new onset of fatigue, dizziness, difficulty standing, palpitations, shortness of breath, and inability to exercise as they previously did. They may also have headaches, numbness, sleep disturbance, cognitive problems, as well as mood issues.
Cardiologist Sadia Khan says fatigue is one of the most common post-COVID symptoms she's seeing in her practice.
Out of the ordinary tiredness. With coronavirus, what we're seeing is that feeling of being wiped out or extraordinarily tired weeks later, even months later.
A study on lingering symptoms found that 87% of patients who recovered had at least one. Alyssa Myaline can relate.
It is now 115 days later, and I am still feeling the exact same symptoms. Life for me now is waking up in the middle of the night and crying because I'm in so much pain and not knowing why.
She used to think of herself as an active and healthy 20-something, but now she relies on virtual physical therapy to deal with her constant back and chest pain.
All of these monitors making me look like a robot give my therapist the ability to check on my movements and see how I'm doing. I can be walking down the street and be perfectly fine, and then I'm heaving and cannot walk another step. I have no idea when I'm going to get better. I have no idea when I'm going to feel like myself again, or when I'm going to get back to the things that I like to do.
She fell sick in March when public health officials told us that recovering from COVID would take about 2 weeks and that older people were more at risk.
I mean, view this the same as the flu.
But by July, it was clear that 20% of young adults with no pre-existing conditions were still suffering 3 weeks after testing positive. The CDC now recognizes that it can result in prolonged illness. Stephen Smith has one of the most unusual suspected lingering symptoms that people told us about, a macular hole in his left eye, which can cause blurry vision and in some cases partial blindness.
It's either a terrible coincidence or it's a new symptom. I wait every day thinking, oh, okay, what what weird thing is going to happen today, because that's how this virus is.
He fell sick after coming back from a work trip in Asia in February. He had a fever, a kidney infection, hair loss, swollen toes, and headaches. But he couldn't get a test because he didn't have a cough.
That's how early it was, is that was the standard in early February, which of course is not the standard now.
His doctor diagnosed him with COVID based on his symptoms. 7 months later, he's still sick.
You need to believe that this is serious, and it potentially can make you very sick, and in some cases kill you.
More than 5 months after getting sick on a cruise ship, Elisa McCafferty is still breathless and so tired that it's debilitating.
I can't even walk up a flight of stairs to go to the loo without losing my breath. I have days where I just cry. For no reason. It'll just set me off. A really bad day for me is I have no energy. I'll have had 9 to 10 hours sleep the night before, but I'll still be bone exhausted. I will ache all over. My brain will just fog. I'll be in the middle of a sentence to a client or a friend and I'll totally lose track of what I was saying.
This uncertainty now haunts thousands of people who are left to wonder, do I now have a chronic condition?
It's like, I'm over it. I'm sick of being tired.
For me to have a good day is like accomplished. It's like I even tell myself, you know what, you did okay today. So go to sleep happy. Hopefully we can get a better day tomorrow. The only thing that helps me a lot is play music. Like whenever I feel like that, I get my guitar, and that's the only thing that helps me.